You don't go to work to think that you're going to get beat up. That's not what we want.
Suddenly, this individual, she became combative, started to throw objects at us. In a split second, their behaviors can change, and we need help.
Across the country, violence in the workplace and healthcare is on the rise, and we have to start getting a handle on that.
Given the rise of behavioral health issues, given the rise of drug issues, our nurses are constantly being threatened.
Strongline certainly has increased our staff satisfaction and their safety. They feel they're safer when they have a direct line to security, and statistically we're seeing they are safer.
Strongline is a simple, subtle, highly effective way for staff to instantly summon assistance to their specific location. But duress events are dynamic, so if an alert originates in one location and then moves, the Strongline system transmits real-time location updates along with the identity of the alerting staff member. Strongline's Bluetooth safety beacon is typically worn with the hospital ID badge. Staff members simply press a discreet button, transmitting a silent duress notification to security personnel as well as other staff in proximity. These instant alerts to nearby colleagues enable rapid response, facilitating early intervention and increasing the likelihood of effectively de-escalating a conflict, even before security personnel arrive.
We found that to be a tremendous help. A lot of the existing applications that are out there do not have that ability.
This device has helped us to alert security a lot sooner than we would have been able to do in the past. As soon as this situation starts to escalate, we can quietly press our button. Prior to the use of the Strongline system, I didn't feel very confident that I would get help if I needed it. We did have a panic alarm, but we had to leave the patient room and go to the nursing station to pull the alarm.
It's hard to get away from something that's happening in a room where you need help right away. When we're able to give them an application such as Strongline, that's their lifeline.
The Strongline team's response to service technology requirements has been outstanding.
It is system as a service, so it's all in one. It requires actually, very little from us.
It was an easy to implement technology. The receivers can go anywhere in our clinical environment as long as there's access to power and Wi-Fi. We've done testing and have discovered that there really is no interference between that Bluetooth technology and other equipment within the clinical environment. And the equipment is consistent, reliable, and easy to support. And that's really important because when we're talking about staff safety, we need that system to be accessible 24/7.
We recently had an incident where a patient became very agitated. He was ready to hit a staff member. The buttons were pushed. Security came up right away. We were able to de-escalate the situation. There was no harm to staff or patient.
This is something that's really important, and it's something that's needed, and as the population and healthcare changes, I think that we're going to need it even more in the future.
So we just said this is one where we're going all in, and we're going to do this for our entire 14 hospital system, and it's been widely applauded by the staff. My message to most other CEOs, embrace the future. Protect your nurses differently. And here's an opportunity to do it easy, do it as a one-stop shop, relatively inexpensively, and you'll be rewarded by having a loyal nursing staff. This is a way of you embracing technology, doing the right thing, and doing it in a way that, frankly, will have a huge ROI. It's exactly the kind of thing that needs to happen as your healthcare system moves into the future.